austerity budget is a budget that projects major cost curtailment in healthcare, amounting to about $4 billion in cuts, mainly to hospitals and OHIP, but also curtailment in long-term care and home care for the next 5 years at least.
This comes back to the implicit assumption that everybody's been making through this process, that our problem is on the expenditure side. And what this chart reminds us of is that the problem is on the revenue side, and it's the unaddressed hangover from the tax cuts that were brought in by Mike Harris between 1995 and 2002. The revenue loss from the corporate income tax cuts alone by 2014 will be about $14 billion a year. So it's a huge impact on the revenue base. So when people say that Canada's fiscal problems, Canada's fiscal deficits are the result of an expenditure problem, they are lying to you. Our fiscal problems, to the extent that we have them, are a consequence of the tax cuts that have been implemented at the provincial level and at the federal level in Canada over the last 10 years. Tax cuts which it turned out that we could not afford.
And people seem to be afraid or ashamed to say that, you know what, we need a healthcare system, and I need this system, and I want to be able to access care. I think the government's done a really good job in the media, and so that our expectations are, many people's expectations are much lower than they used to be or than they should be. And so I think that this is 2012. This is Ontario. We deserve decent health care and decent health care in our communities. And we have to stand up for it, and we have to fight for it, or we will lose it. And I don't want you to believe all the spin about everything costs too much, we can't afford it, we can't afford it. The fact is we can afford it. And I think Hugh did a really good job, and Natalie, talking about the real true costs of healthcare and that the myths that are out there. But we have to fight for this because we will lose it if we don't.